Today I have a very important video for you. One that, as dramatic as it sounds, could literally save your life or the life of a woman you love. October is Breast Cancer Awareness Month. 1 in 8 women, or about 13% of the female population in the United States, will develop breast cancer in their lifetime, which is why it is so important to do regular breast cancer screening. Something I honestly have been neglecting, but after filming today's video, won't any longer, and I hope you won't either. For today's video, I invited my friend, Dr. Ania Weismann, a board-certified radiologist who did her specialty training in breast cancer imaging at Yale University. Dr. Ania and I will be talking about different breast cancer screening technologies, the importance as well as the pros and cons of each of them. So without further ado, let's talk to Dr. Ania. Dr. Ania, it is so great to have you back. I have so been looking forward to this. But really briefly, so we don't confuse people, because you have been on my channel a couple of times and we talked about skincare every time. Tell us really briefly about your background.
Thank you so much for having me on your channel again. I really enjoy filming these with you, and it's fun to be back. So my background initially is I have a bachelor's degree in cellular, molecular, and microbial biology. After that, I did 4 years of medical school, so I have a medical degree. Then I did a 5-year residency in radiology or diagnostic imaging. And subsequent to that, I specialized in breast imaging, which is what we're going to talk about today. And then after that, I did another specialty in aesthetic medicine and skincare. And so that's why we've talked about skincare in the past, and hopefully we will again in the future.
For sure. Now, you and I talked just privately the other day, and I shared my opinion with you on mammograms. And I told you that I am not the biggest fan of mammograms. And I feel ignorant now saying that after talking to you, but I had always been under the impression that you take breast tissue, you squeeze it and you radiate it, and that didn't seem like a good idea.
Mm-hmm.
And I have personally known friends who had a mammogram that was clean. A month later, they found a lump themselves and they're dead now because they had breast cancer. So all of these things together, I just always had this idea that mammograms are useless. And I would always skip them and just went straight to an ultrasound.
I loved hearing that from you. I certainly never get offended. I love hearing other people's opinions. And then I love having a genuine conversation and sort of laying out all the facts and all the information on the table. And then you get to decide, do you still think what you thought, or did I change your mind? Or do you have something where you'll open my eyes and I'll see a new perspective that I hadn't thought of before? So I always think these are fun. So when you told me that, I thought, oh, this is a great invitation, to talk deeper, because I know there are a lot of women who have the same opinion as you. And the fact that you've known women who've had a normal mammogram and then shortly after were diagnosed with breast cancer, that's a fact that can happen. And I can certainly explain how that can happen. But it's not uncommon. I've seen, on Instagram, I've seen reels talking about how the medical community wants to harm women by just unnecessary radiation, and mammograms are just a terrible thing and don't ever get one. So it's nice to get the invitation to maybe dispel some of those myths, or just maybe provide some facts so that the understanding of how mammography works and the radiation and what it can show can be put into context, and then everyone can decide what's best for them.
Now, you shared with me briefly the history of how it came about that we were supposed to have regular mammograms. Share that with us, because I thought that was quite interesting.
Oh, well, I don't remember which president it was. I think it was President Clinton. That the budget for women's imaging throughout the country was always minuscule, because, it's my opinion that in the history of medicine, women are sort of removed to the sidelines, and it's always, a quick fix. Hysterectomies are always a quick go-to treatment rather than trying to work with preserving the uterus. Even the history of the word hyster, like the word hysteria or histrionic, women are hysterical, comes from the word hyster, which comes from the uterus, like hysterectomy. So it just the whole care of women, I feel, has been marginalized throughout the history of medicine. And so was the budget for breast imaging in the 80s, I believe, or no, the 90s. So I don't remember who, but there was someone who was a great activist for women, and she convinced the president to increase the budget. And he said, what kind of a budget do you want? She said, I want one fighter jet equivalent. And so the very first budget for women's imaging came out of the defense department, and it was the equivalent of a fighter jet. And this is why all women in the United States, so if you don't know, if you're in the United States, all screening mammograms are free for all women. And the fee and the reimbursement for mammography is controlled by Congress. And it's really the only medical study that's fully controlled by the government, because the funding was initiated by the government. So it's important for women to know that should they want to get a screening mammogram, it's free. A diagnostic mammogram is different. That may not be free, but everyone is entitled to a screening mammogram.
That's great to know. I actually didn't know that.
Mm-hmm.
And you and I talked briefly earlier about, like you said, the uterus is just taken out so easily.
I agree. And I think in terms of the uterus, the obvious function, obviously, right, to carry a pregnancy. However, there's still so much about the body we don't know. And especially when we get into more if you talk about more Eastern medicines, the Qi, the Ayurveda, I can't say it, the
Ayurvedic.
Ayurvedic medicine, the energetic medicines, the uterus has a lot of value energetically. It's where women really harness their power from, when they can tap into that energy. And of course, that's not Western medicine. So then the value of the uterus is nothing other than having a baby. So if you're past a certain age, you don't need it, just take it out.
Yep. And I shared with you earlier, I have a friend who's in her 70s, and she just had something supposedly wrong with her uterus, and the quick fix was, let's just take it out. And she refused. She said, nope, because I learned that women don't have the same quality orgasms without a uterus. So it is more than just a childbearing organ. But
absolutely. And that's all medicine is a very, physical, you show me the proof and there it is. So when it comes to the energy flow in the body, the more invisible science, the things that are harder to prove, there's a lot of value in the uterus. It's a harbinger for energy for women, and it's just not in mainstream medicine, so that can be neglected.
yeah. But I don't think it's in mainstream medicine either that balls have any purpose aside from,
Having
providing
babies.
sperm. But we wouldn't just cut those off, because men aren't as neglected in medicine as women. So it
They
is
need
kind
their
of sad.
testosterone, yeah.
But let's get back to breast imaging.
Okay.
So I found that fascinating, actually, that what you just talked about. I didn't know that mammograms are free to every woman in the United States, and I don't think most of us know that. Now, you said diagnostic mammograms are different. What do you mean by that? What's the difference?
A screening mammogram is where you go in, you get 4 pictures, usually 4 pictures taken so 2 of each breast, and then you go home and you get a report within a few days. A diagnostic mammogram is either when you show up at a doctor's office because there's a problem, you have a lump, you have pain, some sort of skin abnormality, maybe you worry that you have an infection, you're breastfeeding, something's wrong with the breast. Or you had that screening mammogram and the doctor saw something they were concerned about, and they're calling you back now to further evaluate whatever abnormality that they saw. So the diagnostic mammogram is obviously more expensive, but also you get results the day that you're there. At least you should in a good clinic. You will either speak to the doctor directly, or the technologist will communicate whatever the doctor said. So it may be, oh, what we saw was nothing and you're fine, we'll see you in a year. It may be there's something we want to follow in 6 months, or maybe there's something we see and you need a biopsy.
Okay.
So it's a deeper, more thorough workup for a concern.
Okay. So let's start with the concern of radiation, because that's always been my concern, or one of the concerns I have with mammogram. It is obviously radiation. And I think many of us are at this point afraid of it. We hear that it causes cancer, it causes DNA
Sure.
damage, all of those things. Not only do you radiate the breast, but you squish the cells. So let's talk about that.
Okay. So radiation risk is very scary, especially when people don't understand it. It's easy to be afraid of things that we don't fully understand. And it's strange when you think about that a lot of cancers get treated with radiation. So we expose ourselves to massive doses of radiation that we target at healthy tissue and cancer tissue. But to help people understand in a very life relatable way of how much radiation a regular mammogram is. One mammogram with 4 pictures is equal to 0.4 millisieverts of radiation. And that's the amount of radiation that you experience through normal living on the planet for about 7 weeks. That's what we accumulate as radiation over 7 weeks, the same as one mammogram. And the environment has radiation. Obviously, basements, anyone who spends time in a basement, there's radon in the earth. So we're exposed to more radiation when we spend time underground than, out in fresh air. And of course, we get radiation from the sun, from all kinds of sources. So it really isn't a lot. And to put it in perspective in terms of risk, health benefit risk, the chance of developing breast cancer from one mammogram is similar to the chance of developing lung cancer from smoking half a cigarette once in your life. It's a very, very tiny amount. So just understanding that going about your business for 7 weeks is equivalent to one mammogram. It's a really minimal radiation dose. It's not a CT scan. It's when you're imaging things that are thicker, like bones, for example, or you're trying to go through the entire abdomen. So you've got your dense organs like your liver, your kidneys, you've got all your bowels and vessels in there. You need to apply more radiation so it'll penetrate through the bones, so it'll penetrate through your pelvic bones. So you up the dose. But breasts have really just either fatty tissue or fatty and glandular tissue. So there's no real density there that would really make that radiation dose very significant.
So even squishing the cells and radiating them, and there's still no danger.
Now, let's talk about the squishing for a second, because I've heard of women having the experience where they say they got squished so hard they were sore for a week later.
Mhm.
And that is not what should happen. The reason why you squish is because if you squish, you spread it out. And if you spread it out, you can see more. But at the same time, there's a happy balance between getting enough of that compression to create a good quality image and not hurting the woman, you know,
Mhm.
more than is necessary. So I would say to anyone where they feel they're really being pushed to the max for their pain tolerance, speak up and make sure the technologist, doesn't keep cranking that compression, or maybe even releases it a little bit, because that's not the goal, to put you in pain. The goal is to get it just compressed enough that it's uncomfortable, but it should not be painful.
Okay. So the guidelines right now are to get a mammogram every 2 years. Is that correct? It used to be once a year.
It depends on the community you're looking at. So the American College of Radiology and the Society of Breast Imaging and the Cancer Society all recommend yearly mammograms beginning at age 40, unless a woman is a high-risk patient. High-risk patients have different recommendations. Some patients start getting screenings at 25, but they may not get mammograms. They might start with MRIs. So it can vary if you're in the high-risk category. But for the average woman, you begin at age 40 and you just get annual mammograms thereafter. Now, the task force, which happened in the 2000s, they changed the guidelines. It was done by the government. And they recommended mammograms every 2 years. Now, here I have my own opinion about harm to women. And I think that was a money-saving strategy, because essentially what that works out to is if all women that get mammograms yearly, and some of them will have breast cancer found after 1 year. Now these women are going to have to wait an extra year before that cancer is detected, and maybe their survival rate is going to drop just because they waited that extra year. But think about how much money is getting saved by not having to image someone. You basically spend $0 every other year, in a sense. So it's millions and millions of dollars in savings at the expense of maybe a few lives. And that is, my personal opinion. But I think that that was to the detriment of women. And I say that from my experience of seeing cancer 1 year later and seeing a big change. So if there's a significant change over 12 months, imagine what could happen within another 12 months. It could go to the lymph nodes. And so I think for all women, the best thing to do is to get mammography every single year.
Okay, so yearly mammograms. So I am way behind. I think I've had one since my 40s because again, I told you my theory about it. I was also once told by a surgeon after having had a false positive scare on a mammogram, and I think that's the last time I had a mammogram when I was in my 40s. I was told I should never do mammograms. I should always just jump to an ultrasound, but we'll talk about that in a second because I want your opinion on that. But I told you earlier, I had a friend who had a clear mammogram, and a year later, she found a lump in her breast. And unfortunately, she's no longer with us. So, how do you think that can happen that somebody can have a clear mammogram? Obviously, you do your mammogram and you think, I'm good for a year, I'm good.
That's a fantastic question. And I think if women would like to get just the basic knowledge of their breasts, like basic understanding, they will be able to navigate what studies to do when and how. And what I mean by that is, let's start by explaining the different breast densities, because if you understand that well, it really helps you understand the value of other breast studies like breast ultrasounds and breast MRIs. It really is valuable to just know a few basic differences that will just paint you a brand new picture. So when we talk about breasts, believe it or not, breasts are like our faces. On the inside, every single person looks different. It's kind of crazy. So beginning with a fatty breast, what that means is that there's very little glandular tissue and it's almost all fatty. And fat is a dark gray color and a mass is generally white. So the contrast is really remarkable. And it's extremely easy in a fatty breast to spot a new mass, a new little, focus of white. So if a woman is told that she has fatty breasts, then mammograms are of extremely high value, because any tiny mass that shows up, it may be 3 millimeters in size, so very tiny, will show up on a mammogram. And in addition, when you have a very fatty breast, it's very easy to see calcifications as well. Actually, calcifications, I take that back. Calcifications are easy to see on all breast densities. And that's where the value is for mammograms, on all breast densities. But we're focusing on masses now because that was your question. So fatty breast, very easy to see a mass. The next stage is scattered glandular tissue. So there's a little bit more glandular tissue than in a fatty breast. The next category is heterogeneous glandular tissue. So that's about 50 to 75% glandular tissue. And then there's extremely dense breasts. And extremely dense breasts are the ones that are perky. You don't need a bra. They have a lot of hold and shape to them. That's how you know clinically that you probably have a very dense breast. Whereas a fatty breast is just like this floppy thing that has no real internal structure of its own, and you really need a bra to shape it because there's very little of that firm glandular tissue, fibroglandular tissue. So the women with the dense breasts are blessed, visually, but they're not blessed mammographically because that tissue is white. And I said cancer shows up as white. And so if you have a breast that is extremely dense and it's full of white tissue, and then there's a white mass in there, you will never see it. And so that's why also there was a time where self-exams weren't recommended anymore, and that's something I've never agreed with because I believe a woman knows her body better than anyone else. Now, if she never does breast exams, that's one thing. But if you feel something and it feels off to you, plus we have great intuition just naturally as
Mhm.
women. I fully trust in the intuition and a woman knowing her own body. So I'm a huge advocate for self breast exams. And the easiest way to do it is in the shower with shower gel. So you're not really feeling any tension on the skin and you can really feel what's underneath. The challenge to that is dense fibroglandular tissue is lumpy bumpy. So you can
Mhm.
feel a lot of lumps and bumps, but I say that's okay because you get to learn your body and the same lumps are always going to be there. They might fluctuate slightly in sensitivity depending on the time of the month, but generally your anatomy is your anatomy. So if one area is bumpy and it's always bumpy, as long as it never changes, it's okay. If you feel there's a change, there's an extra lump, or this just feels different than before, then it's a good idea to have it checked out. But to answer your question, the dense breasts are so white that the white masses get hidden inside that glandular tissue, and you just can't see it on a mammogram. And that's where the ultrasound and the MRI is of extremely high value. The ultrasound will show you a mass and it will even differentiate a cyst from a mass. So if you have a cyst, like fibrocystic changes that are common in women, the ultrasound, if it's a little circle that's black inside, that's water, so that's a cyst. And if it's something dark and it's irregular and it's firm, then it's more likely a mass or something like a cancer that you need to be concerned about. And then we look at other things like the features of the mass, if it looks more benign or if it looks worrisome. So there's characteristics we look for. But basically ultrasound can then, if you see a white mass on a mammogram, it can also be a cyst. You go to ultrasound, ultrasound will differentiate one from the other. But ultrasound won't see those microcalcifications, which can be the earliest signs of cancer.
Okay, so what I was told I should just skip a mammogram and jump straight on ultrasound is not quite correct because you can't see calcifications.
Exactly.
Can you see the calcifications? I'm assuming that they're white as well. Can you see them in very dense tissue in
Yes,
mammograms? You
you
can.
actually can, and maybe we'll put up an example to show everyone what that looks like, because the whiteness of the tissue and the whiteness of the mass are the same, but calcifications are just bright white. And no
Mhm.
matter how dense your breast is, you will still see calcifications because they're even whiter. They're almost as white as bone on an X-ray because
Okay.
calcium, bone has calcium in it. So they are just so dense. And when we see calcifications, then we like to, again, look at the morphology of the calcifications. Some calcifications have features that are typically benign, and other calcifications have features that are highly suspicious for cancer.
Okay, so not every calcification is necessarily malignant. It could be just,
Not at all. It
okay.
could absolutely be a normal part of a woman's anatomy.
Okay, so even somebody like I who has very dense breasts, who has been told by a surgeon to just skip the mammogram, it's still a good idea to get a yearly mammogram just to make
Mhm.
sure that there are no calcifications.
That would mean that you're looking for the earliest signs of breast cancer. So not all cancers have calcifications, but the ones that can grow into masses, some of them begin as calcifications. So we want to catch it before it's even a mass, before you would need any kind of chemotherapy, where it's just easy to treat and the survival rate is, 99%.
Okay, but so somebody like myself or my friend who found the lump herself afterwards, it would have been a good idea for her doctor to say, listen, you had your mammogram, but now you still need an ultrasound. So we should have that dual diagnostic. I
So
would think.
for dense breasts, generally the additional ultrasound is recommended. The community is split on this, but you can justify an ultrasound for extremely dense breasts. And generally, the recommendation is high risk or moderate risk patients. But
Mhm.
just having very dense mammograms can justify the ultrasound so you can see inside the breast a little bit better. The best diagnostic tool to really evaluate the breast would be an MRI. The issue with MRI is multifold. One of the problems is the cost. A lot of insurance companies don't want to pay for MRIs. And the second thing is they're very time consuming. So a mammogram is just a few minutes, an ultrasound is just an additional few minutes, and an MRI is, a 40-minute study, and you need IV contrast. It's a production. People don't like to take up magnet space. They want to do, the more important studies. But right now, rapid protocols are being implemented where an MRI is done and it's actually just the necessary sequences essentially to look for cancer. It's a quick study. It doesn't take a long time and they're less expensive. So I know that programs like that already exist in Europe and in Germany, actually. And hopefully that is the future here in the United States, because that would be superior to ultrasound in finding early masses and looking for, and absolutely the density of the breast doesn't matter for MRI. The hormonal changes throughout the month matter more because there's background noise, because MRI is all about blood flow. So it's more of a functional test, whereas most of the blood flow going within the breast. So when you have glandular tissue stimulated by our hormones, it can light up a little bit more. So ideally you'd get a breast MRI in the second week of your cycle, but that's not even being considered a requirement anymore. Women can come in any time of month and it's just a quick screen.
Okay, so that would then be the only test needed, is that kind of MRI. You would need a mammogram and an ultrasound.
You could absolutely replace the ultrasound with the MRI, and I would say it's a far better test. And I would say the high quality clinics, when they're going to do an additional screening study, they would do an MRI over an ultrasound. And if I was a high risk patient, I would absolutely prefer an MRI over an ultrasound. And in fact, the American College of Radiology has an official recommendation now that women who are high risk, which is greater than 20% chance of developing breast cancer, are recommended to have an annual screening MRI. You should still have your mammogram though, because it's the best test for those calcifications.
I really hope you enjoyed this video so far. And if you, like myself, have neglected to do regular breast cancer screenings, I hope this video inspired you to do so. Now, as you can probably tell, this video is not over. Dr. Ania and I talked for about an hour, but I'm stopping this video right here, and part 2 of this video will be on Dr. Ania's channel. I will link it down below in the info box, and as soon as this video is over, you can also click right here and watch part 2. Any questions or comments, please leave them down below. Always love to hear from you. And I would love to know, do you do regular breast cancer screening? And if so, what do you do? Mammograms, MRIs, ultrasounds, a combination? Please share down below. Thank you so much for being here. Until next time, bye, and go watch part 2.